Manual handling safe principles. Training aims to ensure that all participants can safely and correctly demonstrate and perform the safe principles whilst performing all manual handling tasks. The learning outcomes. Participants will be able to state the 7 safe principles. They will be able to perform the 7 safe principles during a moving and handling task. They will be able to recognise the importance of applying the safe principles, and they will appreciate the consequences of not applying them during all moving and handling tasks. So these are the 7 safe principles. The first one is to stop and think. And this is where you're going to assess, plan and prepare. This is also where you would do the LITE risk assessment, which I'll cover in a separate lecture. Once you've assessed and planned out your movement, you're actually going to do the movement. So when you do the movement, you're going to maintain good posture. You're going to bend your knees as appropriate. You'll adopt a balanced stance. You'll have a good grip on your load. You will hold the load close to your body, and you will move your feet to change position. So why should we use the safe principles? They provide one of the best ways to avoid injuries due to manual handling tasks. They represent the natural way in which the human body is supposed to move. For example, the spinal column and the back muscles are not designed for lifting. Consequences of not following the safe principles. The risk is in incurring injuries that are cumulative in nature, which include muscle ligament strains, intervertebral disc prolapse, hernias, tendinitis, and joint sprains. So the first one is stop, think, assess, plan and prepare. So knowing what you're doing and where you're going will prevent you from making awkward movements while holding something heavy. Clear a path, and if lifting something with another person, make sure both of you agree on the plan. Try to head in a straight line. Always ensure that whatever you're lifting is not too heavy. Maintain good posture. So tighten your abdominal muscles will hold your back in a good lifting position and will help prevent excessive force on the spine. Looking slightly upwards will help you maintain a better position of the spine. So bending your back is completely incorrect, as demonstrated in this illustration. You need to bend your knees. So focus on keeping a natural curvature of your spine. Raise and lower to the ground by bending your knees. Your legs are many times stronger than your back muscles. Let your strength work in your favour. Again, lower to the ground by bending your knees, not your back. Keeping your eyes focused upwards helps to keep your back straight. Use your legs to lift and to position your body. This is how we would pick up objects from the floor as a child, up to possibly like the age of 2-3 years old. This is how all children pick items up from the floor, and this is the correct way to do it, and it's innately programmed into our brains to do it in this correct, safe manner. Now what happens is the child learns from adults that they observe picking objects up in the incorrect manner, and as a result they change the way they pick things up to mimic the adults doing it incorrectly. But this is absolutely the correct anatomical method of picking things up from the floor. You need to adopt a balanced stance. A solid base of support is important while lifting. Holding your feet too close together will be unstable. Too far apart will hinder movement. Keep the feet staggered, shoulder width apart, and take short steps. Have a good grip on your load. Hold the load close to your body. You will be stronger and more stable lifter if the object is held close to your body rather than at the end of your reach. Make sure you have a firm hold on the object you are lifting and keep it balanced close to your body. You're a much more stable lifter if you're not reaching for an object. Move your feet to change position. Face in the direction you're walking. If you need to turn, stop, turn in small steps, and then continue walking. So in summary, the 7 safe principles again. So the first one is to stop and think. This is where you use your lighty to assess, plan and prepare. Maintain a good posture. Bend your knees. Adopt a balanced stance. Have good grip on your load. Hold the load close to your body and move your feet to change position.